Hi, I'm Dr. Chad Guess, and today we're going to go over how to do a nutritional exam on your patients, and particularly your chiropractic patients. I am currently sprinting into my 20th year of practice, and I hope this will demonstrate to you how we use this on a chiropractic patient who comes in just for pain. Unfortunately, as chiropractors, we have pigeonholed ourselves into just pain doctors, and if you ask most of the public, they look at us as just pain doctors. And in reality, we are doctors that can do a lot more. And so we use the nutritional exam in our office to start to show people how the spine does more than just pain, how it can interact with the organs, how nutrition plays a big part of this. When we're looking at this exam, these exams that we're going to use have been in use for over 50 years. Several doctors, even medical doctors, have come up with these. Dr. Riddler, Dr. Chapman. One of my favorite ones is Dr. Ragland, who addressed the adrenals. So we hope to demonstrate today how these work. So how we process every patient, whether they come in as a chiropractic pain patient or they come in as a nutritional patient, is the same. In my mind, they are no different. I treat all my patients the same because I'm not treating symptoms, I'm treating causes. So every patient that comes in will have to have filled out a symptom survey form so we can start to get an idea of what their current state of health is. And the beauty of this new form is at the bottom, the nutritional exam is on there so you can start to record this data. So in reality, when I'm looking at the spine or at a patient, the spine to me is nothing more than a big circuit breaker box in your basement. Every wire that comes out of the circuit box in the basement goes to a different room. One goes to the kitchen, one goes to the stove, one goes to the dryer, in the bedroom. And what happens is when those wires become overloaded, it trips the circuit breaker and breaks it. And when people are coming in to my office to be seen, that's how my mind is starting to think. As I look at their subluxation patterns, I'm starting to look at what organ is affected with that. So T1 could be heart, T4, 5, 6 could be stomach, pancreas, gallbladder. And it's starting to paint a roadmap for me to what's wrong with them. And it'll also help the patient start to understand that sometimes the pain that they're experiencing in their back has nothing to do with their spine. It could be the associated organ of the spine that is sending a referred pain signal back to the spine. So again, as you're looking at the patient, we're starting to see a roadmap. Every patient that comes in, where they have pain at, where they don't have pain at, where they have vertebral fixations at, is painting this whole big painting for you so that you can start to see what's wrong with the patient. So if we look at this, we have a couple of main reflexes that we want to look at when we're dealing with the spine. The first is the somatic visceral reflex, and that would be where a subluxation in the back disrupts the nerve flow going out to an organ and does not allow that organ to function optimally. The other one that is just as important and is often overlooked is the visceral somatic reflex. So let's say an organ is not functioning well, and we'll take the stomach as an example, and the person is having a lot of heartburn or indigestion. That stomach, by not working properly and is inflamed, is sending too many signals back to the spine. And what will start to happen is, once the signals get to the spine, it starts overloading the brain with too many signals. And the body, as a natural defense mechanism, will not want the brain to be overstimulated. So the body will trip that circuit breaker, which would be the vertebrae, and that's where we start to see a chronic subluxation pattern in the body that is actually a visceral somatic reflex coming from a stressed organ that is not functioning well, and not necessarily an injury as we see in other cases. The beauty of this is we have what I was referring to as the symptom survey has been reworked, and it's into the system survey. And with that, on the back, we have the nutritional exam that we are going to talk about. This needs to be done on every patient so that we can track what's happening to them. And another big mistake I see being made is we don't track patients' symptomatology as they go through care. And we don't get credit for what we actually help with. How many people have you adjusted over the years and they have gotten better sleep, more energy, less headaches? As we can track this with this symptom survey, we can also demonstrate to the patient how their health has been benefited outside of just the pain gain. One of the first things I learned when I was working with my patients, that anybody that came in with allergies or tendonitis or bursitis, I started to figure out if I worked on their digestion and helped improve the acid in their stomach, those symptoms started to go away. So I slowly started to incorporate all these exams, tests, and the system survey in with my patients and started to see results, and I started to learn more about physiology. The great thing about these forms and this exam, it's free and it can be gotten from your standard process rep or distributor. And even better is they are equipped to come in and train you on how to do this. So this can be a nice flow in your office when you see a new patient. And it doesn't have to take very long with the new patient. A big concern a lot of doctors have is they will be consumed by doing this exam and they won't have time to see patients. And it only takes a matter of minutes to do these exams. As your office becomes more established, like mine, all my office workers have been with me over 15 years. I now have a couple of trusted office workers that have been fully trained, and they now do most of these exams for me. What we're going to start with first is what we call the big three here on the left side of the page, and that would be stomach, pancreas, and gallbladder. And we're going to start to look where digestion really starts with the body. Most people, when they think of digestive problems, they immediately think of the colon, and we need to go back upstream to where digestion starts, and that's with the stomach, and then the pancreas, and then the gallbladder. So we are going to demonstrate these tests for you. The first point we are going to demonstrate is the HCl point, which was developed by Dr. Riddler. So we're going to have the patient come in so I can show you where this point is at. This is a very simple point to find. You first find the xiphoid process. You come to the bottom of the xiphoid process, and you drop down about 1 inch. And then you're going to move to the left an inch, or it could be more than an inch, until you find the edge of the rib cage. And what we want to do is palpate the rib cage at a 45-degree angle. We don't want to go straight in at the rib cage. We don't want to dig into the soft tissue, but at a 45-degree angle in the rib cage, we're going to put a decent amount of pressure on there, and we're going to do a circular motion. There should be no tenderness or no pain to this. And if a patient demonstrates that it is painful or tender, we are going to have them rank this 0 to 5 so that we can record this onto the sheet. Now, we do lots of palpations, and you can push directly into a muscle. There should be no pain or tenderness. It just should feel spongy, and the patient feels pressure. You can also push directly on bones, and again, there should be no pain or tenderness. It just feels like you're touching their bone. And so when you ask the patient, it's not, is there pressure on the bone? Is there any tenderness or pain when we demonstrate this test? The HCl point is going to be one of the most common points that you find. And if you think about the world we live in, one of the most prescribed drugs that is out there is some form of antacid or proton pump inhibitor. So you are going to find this point a lot on people. The next point is the enzyme point. And it's the exact opposite of the HCl point. So again, you find the bottom of the xiphoid process, drop down 1 inch, and now you're going to move to the right until we find the angle of the rib, and again palpate that and ask if there's pain or tenderness. If there is, they're going to rank that 0 to 5. As a chiropractor, this is how you can start to correlate your physical exam findings with their current symptomatology and the nutritional exam. So when you're looking at the HCl point or the enzyme point, we're looking at digestion, particularly of the stomach and pancreas. So in the human body, if we're looking at the subluxation pattern, we'd be looking at T4, T5, or T6, probably more T4 and T6. So it would be wise to follow up with palpation of the spine and find any correlation with tenderness or subluxations. And that is how you can start to explain to the patient the difference between a somatic visceral and a visceral somatic reflex. The next point we're going to move to is called the Murphy's point, and we're going to be looking at the gallbladder and slightly the liver, and this is looking at fat digestion. So you want to have the patient lying flat on their back, face up, and then you will ask the patient to bend their knees a little bit more, and then we will start the palpation process. But so that you can see what I'm doing, I'm going to go ahead and ask the patient to put her knees back down. So the general area of the liver and gallbladder is on the right side of the abdomen. So you're going to come in just below the rib cage, and you're just going to lightly palpate just under the rib cage, because you'll find a lot of patients, even to light touch around the rib cage area, will be tender or sore, and they've immediately failed this test. If that is not tender or sore, the next stage of the test is you take your fingers, again at a 45-degree angle, but instead of pushing directly on the rib, we're going to go underneath the rib and try to push up underneath the rib. And again, lightly palpate it and ask if there's any tenderness. If there's still not any tenderness, then we're going to take the test a little bit further. We're going to palpate underneath the ribs, and then we're going to ask the patient to take a deep breath in. And again, ask them if there's any tenderness or soreness there. If at any point during this test they have any tenderness or soreness, we're going to ask them again to rank that 0 to 5 and record that. But anytime there is any tenderness or soreness, you will consider that a failed test or a positive finding. So quickly, we're going to show what the test would actually look like. Again, you'd ask the patient to bend their knees. You're going to come in and just lightly palpate underneath the rib cage and the abdomen to see if there is any pain or tenderness. The next is to lightly palpate at a 45-degree angle under the rib cage to see if there's any pain or tenderness. The next stage of the test would be to have the patient breathe in and then blow it out. And then you push up underneath the rib cage a little further, and at the end you ask the patient to inhale fully. And if at any point they have pain or tenderness, that is considered a positive test. As a chiropractor, you want to confirm these findings with the palpation of the spine or looking for a subluxation, and the primary area would be T4. Just remember that some patients will have one vertebral level difference with their palpatory findings. So you're looking at the general area T4, T5, T6. So when we did the last test, which was Murphy's sign, that's more of an acute gallbladder situation. Now we're going to do what we call the chronic gallbladder situation. And this is the meridian point L14. And it's been used for a long period of time to assess the chronicity of a gallbladder situation. So this is rather easy. You take the person's right hand and you want to palpate into the web of the hand. You do not want to get clear into the muscle or clear out on the edge. You want to get right in the middle of the web and you want to lightly squeeze it and pinch it. And again, you're looking for pain or discomfort, or you actually could feel little nodules in there. It'll feel like little round bumps in there. And if we have tenderness or discomfort or pain, or we feel these nodules, then you're looking at a chronic gallbladder situation. The next test we are going to do is the large intestines test. This was developed by Dr. Chapman. We are going to find the ASIS, and we're going to move medially, maybe a ½ inch to an inch, to what would approximately be the ileocecal valve. We are then going to push straight down into the abdomen and palpate it. As we do this, we're going to move up the ascending colon, and all the way we're going to ask the patient if there's any tenderness, discomfort, or pain. Then we're going to move laterally across the transverse colon and continue palpating. And then we will move down the descending colon and end at the exact opposite point, which would be about where the sigmoid colon starts. And we're again looking for tenderness, pain, discomfort, or even sometimes on palpation, it's going to feel really firm or nodular. The two most found points, or the points that usually are the most tenderness, is the beginning point where the ileocecal valve is, or the ending point where the sigmoid colon is at. You will find some patients that are tender throughout the whole palpitation process. And when I find that, that's when I start to consider doing a detox or a cleansing program with them. There is further testing that can be done with this, which is a lingual test that you can talk to your standard process rep or distributor about. The next test we're going to do is tissue calcium. And as a chiropractor, this is one of my favorite tests. We're going to assess the level of calcium in the tissue. And we're going to just simply use a blood pressure cuff, which you should already have in your office because you're doing a blood pressure check on all your patients. When we look at calcium in the body, and particularly when we're looking at the musculoskeletal system, we're looking at inflammation levels because calcium is used by the body to help handle inflammation. We're looking at tight muscles. Calcium is used by the body to help relax a muscle. And we're also looking at how your body responds to trauma or it heals. So this is a very easy test to do. You take the blood pressure cuff and you want to put the part that is supposed to constrict the artery around the calf, so it would be to the back. And we want to wrap the blood pressure cuff around the largest part of the calf and get it snug. Not on the knee, it's going to be just below the knee. And we're going to simply pump this up. Now, to pass this test, you should be able to pump this cuff up to a minimum of 200 pounds, and ideally it would be 240 pounds of pressure. So we're simply going to start to get this to 100 pounds. Once we get to about 100 pounds, we're going to start to ask the patient at any point, if you feel a cramp or a sharp pain, just let us know. And if you notice, once I got to 100 pounds, I slowed the pumping down. Any problems with that? And she passed the test. One of the biggest mistakes we see being made with this test is people pump too rapidly, and it doesn't allow the physiological response to set in. You can go somewhat fast to 100 pounds, but once you reach 100 pounds, you want to slow down the pumping so you give the body time to respond to the stress of being constricted and allow the patient to be able to feel a cramp or a pain. And again, if they feel a cramp or a pain before they reach 200 pounds, they have failed the test, and this is now a positive result. A couple considerations that need to be taken into account. We want to make sure there's no issues or possible issues with deep vein thrombosis. The other thing is, if the patient has severe varicose veins, and in particular that the varicose veins are painful, that would be two indications not to do this test. If you do get a positive test, or they fail the test, in other words, they didn't at least get to 200 pounds of pressure, we also have to consider the cofactors to how the body utilizes calcium. We already demonstrated one of them, and that would be the HCl point. If they fail the HCl point, they probably need digestive aids to handle the calcium. And the other big cofactor would be fats. I look at minerals like the quintessential teenager. They do nothing in the body unless they're told to. And we have to look at the cofactors that actually move calcium through the body. So to get calcium into the blood, we need vitamin D. To move calcium out of the blood and into muscle, we need fat or omega-3s. And to move calcium out of the blood and into bone, we particularly need vitamin C. And these are the cofactors that we have to consider when we have a positive or a calcium cuff test. With the calcium cuff test, there is a neurolingual component to it to help us figure out what the patient needs so that they don't fail this test. I do this on every patient in my office, and I find this particularly important because if you can demonstrate quickly a change in that test, then the patient can see value to why they need to take a certain supplement. So all we have them do is we will start trying different supplements, and we will give the patient 2 or 3 of the supplements and ask them to chew it in their mouth for 30 seconds to a minute. And then we'll wait another minute, and then we'll repeat the test. And when you find the right supplement for them, what will happen is instead of failing the test at, say, 110 pounds, they will suddenly be able to increase the pounds to 180. And that is demonstrating this is the supplement that they need to take to now pass that test. You do want to have lots of water around so that once you've redone the test, that they then wash the supplement out of their mouth. Don't let them chew the supplement and then drink water and wash it out before you repeat the test. You want to leave the supplement in their mouth. Again, for further information on this, please contact your standard process rep or distributor. The next test we're going to do is the pH test, which is essentially looking at EFA need in the body or essential fatty acid. So really, if we look at the oral pH should be neutral between 7.2 and 7.4. Once food has been chewed and is swallowed into the stomach, for proper digestion in the stomach, the pH should be between 1 or 2. If the pH gets up to around 5, there's really no ability for the body to digest protein. Once the food leaves the stomach, it goes to the small intestines, and the pH should shift back to a basic environment, probably in the 8.3 range to 8.5 range. Once it's done with the small intestines, it moves to the large intestines, and it moves to a slightly acidic state again. So what we're going to assess with the oral pH is if there's any imbalances with the pH in the body. Probably the majority of the time you're going to find an acidic value when you do the oral pH, and that's really looking at essential fatty acids to start to shift that pH. There will be times that you find alkalinity in the mouth, and that's where we have to start looking in other directions. One possibility could be like allergy states. This test is really simple to do. You will have a strip of pH paper, and you will ask the patient to put it in their mouth for just a few seconds and allow the saliva to soak into the pH paper. Once you pull that out, you will then compare the pH paper to the values on the box so that you can determine what the pH is orally. A consideration with this test is to try not to have any of the patients haven't eaten any food or drank coffee for an hour or two before they come in, because the residual effect could alter the pH. The next test we're going to do is Ragland's test, and it was developed by Dr. Ragland to assess the function of the adrenals. And it's actually one of my favorite tests to do because in reality we're looking at stress and stress adaptation in the body. This test is fairly simple to do. You're going to take a blood pressure cuff reading while the patient is lying down. You will write that number down. You will wait about 2 minutes. The importance of this test is only the systolic blood pressure. Once you have released it for 2 minutes, you will then repump the cuff up to about 20 points higher than their systolic reading was when they were lying down. Once you get the cuff to 20 points higher, you will then ask the patient to stand up as fast as they can, and you will slowly let the air out of the cuff and retake the blood pressure. Ideally, what you want to see is when a patient stands up, that their blood pressure goes up 6 to 10 points. This is going to be a very rare finding. You will find a few that does this. The vast majority of the people you do this on, their blood pressure will actually drop when they stand up. And it can be very drastic. I've seen 30 and 40 point blood pressure drops when a patient stood up. In today's world, I'm actually happy if we don't get any drops. So if we take a blood pressure when they're lying down and their systolic is 120 and they stand up, it's still 120. I'm going to take that as acceptable. I may still supplement it, but I'm very happy about it. But if they stand up and their blood pressure drops, then we got to support the adrenal glands and how their body is handling stress. And you can correlate this with a good history and a couple of quick questions. Do you get dizzy? And particularly, do you get dizzy when you stand up too quick or you get up out of bed? And if they're saying, yes, I experienced dizziness when I changed position, you can all but guarantee that they're going to fail this test. If you have an elderly patient and dizziness is already a problem, and stability is a problem, you may not run this test. I will just ask, do you have problems when you change position? And if they say, yes, I get dizzy, in my mind, they have failed that test, and I'm going to proceed forth as it has been failed. I'm going to demonstrate the test for you now. The key thing is when you ask them to stand up, please make sure they hold on to your arm while they're standing up. In case they do get dizzy, we don't want to see them fall to the floor. So it's pretty simple. While the patient is lying here, you will take a normal blood pressure and then let the air out. And obviously I don't have my stethoscope on, but once you've gotten a number, write it down. We're going to wait approximately 2 minutes. Once the 2 minutes are up, we are going to repump the cuff up to 20 points higher than what the systolic reading was when they were lying down. And so we're going to repump it up. You're going to support the patient's upper arm, and you're going to have them hold on to their arm and stand up as fast as you can. And then again, let the air out and re-record the number. And if you notice, I have a hold of her so that she can't go down if she does get dizzy. Okay. The next test we're going to do is the paradoxal pupillary response test. And this really is an either-or with the Ragland's test of assessing the adrenals. So the way that you can do this is you will shut the lights off in the room so it's fairly dark. You will need some kind of instrument that can shine a light in the eye. What you will do is, with the lights off, is shine the light into the pupil from about 6 inches away. What should happen when you shine a light in the eye is the pupil should constrict, and it should stay constricted for 6 to 10 seconds before it slowly starts to dilate back open. And that would be considered a normal response. What you will see in these stressed out patients, no different than the ones that stand up and their blood pressure drops, is the pupil will constrict and it will dilate again faster than it should. And what we're looking here is a stress response in the body. When people fail Ragland's or they fail this pupil test, you're looking at a sympathetic dominant person who is overstressed and they are stuck in this fight or flight syndrome, or we're what we call wired but tired. When you shine the light in the eye, the stress to the nervous system is what causes the pupil to constrict. And so when we get these abnormal tests, the nervous system is not responding properly. And one of the big places we look at is adrenals. But don't forget, this also corresponds with adjusting the spine. And that would be roughly the T9 region for the adrenals. Again, we're going to do this test with the lights out. Once the lights are out and it's fairly dark, you're going to shine a light in the patient's eye from about 6 inches away. The pupil should constrict and stay constricted for roughly 10 seconds. You'll have various levels of adrenal fatigue. If they constrict and immediately pop back open, that is considered extreme fatigue. So what we're looking for is the stress on the nervous system in the response here. Again, the pupil should stay constricted for roughly 10 seconds. The next test we're going to do is a zinc taste test, and you will need a liquid form of zinc, which can be gotten from your standard process rep or distributor. And we're going to assess the level of need in the human body for zinc. It's an easy test to do, and we're going to demonstrate how to do it in just a minute. But don't forget, most people think that zinc is just for colds and flus, and while zinc is very important for colds and flus, zinc has been shown in numerous studies to help with inflammatory levels in the body. So what you will do is you will take the zinc and you will pour a few milliliters into a cup, and you will give the cup to the patient, and they're going to put this in their mouth and not swallow it. They're going to swish it around, and you're going to ask them, do you taste it? Now, if you get a true test where they need no zinc, they're going to taste it immediately and probably make some weird face and maybe possibly spit it in your face. Just kidding. If they can't taste it at all, that is telling us that there's a great need for zinc. And again, there's varying levels. If they swish it around and it takes several seconds to a half a minute before they taste it, again, that's showing a great need for zinc. But if they taste it immediately, there's no need for zinc in the body. The next test we're going to do is to assess the level of need of iodine in the body. You will get a tincture of iodine, which can be gotten from your standard process rep or distributor. And this isn't the end-all be-all test to decide if you need iodine. It gets us a good idea of whether we need to supplement the patient with iodine. But it's a roll-on, and you will take the roll-on, and you will have the patient put this on after showering in the morning. So once the patient gets out of the shower, they will put the iodine roller on their arm, and they will paint a 2-inch by 2-inch square on the arm. They will then write down what time they did that. And then they are going to observe for the next 12 to 24 hours how bright that iodine stays on the arm. Years ago, they used to say the gold standard was if you could still see that patch very well after 24 hours, there was probably no need for iodine in the body. In today's world, if we can get 12 hours out of that, we're very happy. So throughout the day, they will check that patch. And once they start to see it to fade, so let's say after 3 hours it starts to fade, they're going to write down the time and report back to the doctor. In 3 hours it started to fade, and that's going to give us an idea of the need for iodine in the body. One of the things you need to tell the patients when they do this test is when they put that on there, this will stain. So they will need to blow on it to help dry it, and then just to double check, they can lightly blot it with a Kleenex or something to make sure that it won't get on the clothes. In consideration, you have to look at where you live. Here in the Midwest, it's probably fairly common or certain that they are going to need iodine, whereas you live more in a coastal region of the United States, the need for this test will decrease. So take into consideration your geographic location. Again, all of these tests that we have done should correlate back to your chiropractic findings or exam. Again, as we're doing our palpation and exam, we're looking for fixations at certain level or subluxations. We're also looking at point tenderness along the spinous processes, and at times it can be along the transverse process. These will correlate nicely with the chart that you see on the wall behind me that you can get free from Standard Process, which will remind you at what vertebral level, what organ is associated with that. All these things should tie together a good history. Learn to ask more questions and not just concentrate on the pain level or where the pain is at when the patient comes in. Correlate that with a good exam, and it all ties together nicely with the nutritional exam we just demonstrated. And again, in review, these tools that we talked about today, such as the poster, the iodine patch test, the zinc test, the pH test, and even the system survey form that has a nutritional exam on the back of it, these all can be gotten free, or they can be gotten from your Standard Process rep or distributor. So please contact them to get this stuff, and they can help review these tests with you so that you have confidence in doing these with your patients. We demonstrated all these for you, and it seems like it takes a little bit of time, and in reality it doesn't. Doing all these tests myself generally never takes more than 5 minutes. And I have great confidence in doing these, and I often do these routinely myself. I'm fortunate enough that I have 2 staff members that have been properly trained and been with me many years, that they also can do all these tests for me, which saves me a great amount of time. As a matter of fact, when a new patient comes into my office, before I even see them, my staff has completed a nutritional exam on the patient before I walk into the room. But even if I have to do it, it takes me no longer than 5 minutes, and these are things that you can easily learn yourself. Also, don't forget to reevaluate your patients. In my office, the standard operating procedure is every 10 to 12 visits, particularly with a new patient that is in an acute situation, when we do our normal chiropractic re-exam, range of motion, orthopedics and such, we also redo all the positive findings that we found from the nutritional exam. A great one, as an example, would be the calcium cuff test. Is on their first visit, they failed to test at 110 pounds of pressure. When we come up on the 10th visit and reevaluate them with the chiropractic exam, the staff immediately knows to redo the calcium cuff test, and this time they may fail to test at 180 pounds, and that shows a great improvement. So you can use these tests to show the patients where they are at and how they are progressing with their care. Even if you're not a chiropractor, you can still utilize all these tests in your practice. And you can still palpate the spine, and acupuncturists can palpate along the spine for tenderness, and some of those will correlate to some acupuncture and meridian points. Naturopaths, MDs, DOs, whoever it may be, all these tests have relevance, and you can still use this chart and just palpate for tenderness along the spine to correlate your findings. I'd like to thank you for joining me today, and I hope you realize and see the benefit to doing these tests. They don't take long. It's quick and easy. I call them show and tells. The patients can quickly see the benefit from doing these tests and how it will improve their health. So I look forward to hearing back from you to how this has enhanced your practice, just like it has enhanced my practice, and more importantly, how it's enhanced my patients' lives.